Hey, it's Dr. Schmidt. So I want to share some lessons that I've learned with you in the last about 10 days in my office. So I have a guy that he's got a high coronary artery calcium score, meaning he's got too much calcium in his arteries. And he did everything correctly. He took all the right supplements. He's in ketosis every day. And his score kept going up. Now it's not going up beyond 15%, which is dangerous. He's still in that sort of safe zone of going up by 8 or 10%. But my goal is always to bring it down. Why not? Get that coronary artery calcium score down. And I don't recall, but the last time we tested it was like 2,000. Anything over 100 is bad. He's at 2,000. So when I talked to him many months ago, I said, I think you have a hidden infection somewhere in your body because the calcium deposition in the heart and arteries can be caused by bad food like sugar, obviously junk food. But he's been keto for like 2 years. And so, what is the other potential? That would be infection. And so, his body's clean. He's got no pain, no chronic pain, no fever. He doesn't sweat at night. His body's not trying to get rid of a virus at night. And because of that, I ruled all these other potential possibilities out. And I said, it's probably in your jaw. You can have infections in your jaw causing no pain. A dentist looks in your mouth. They can't see it because it's deep. You got to get a 3D X-ray, like it's called a cone beam, or a Cavitat is the other manufacturing company that makes this device. And he did it, and they found 7 infections in his jaw. 4 were severe. He had those. They were old root canals. Root canals fail all the time. He had them pulled out, and they ozonated, and then we'll see. But the point of me saying this is that the dentist worked on his mouth for 5 hours, and she was pulling out jawbone that was black, and it's sad that he has to go through this, but it's kind of cool that I just ruled out a bunch of other things, and I said I think you have an infection in your jawbone because he wasn't responding to the ketosis diet. He wasn't responding to the correct supplements. Now I have another patient, I think, and it's been a few months now, but I think his main concern was high blood pressure. And I've had him on the right supplements and the right diet, and he didn't get better. So I said to him, I think you have an infection in your jaw. So he goes to get the cone beam, and it comes back positive, and it's going to cost him a lot of money to get that fixed. And, he's going to call me when he's ready. It might be 6 months from now. It might be 8 months from now. But he's very thankful that I gave him the right information. And it's just 20 plus years of doing this holistic healthcare, hardcore holistic nutrition field. I can rule things out based on symptoms. There's only a finite number of causes. And if it's not cause A, B, C, D, or E, and the only thing that's left is the last one, then you got to, find that out. Do you have the last cause? Now I have a guy, this is another similar story, but not related to the jaw. So I have a guy, he's a very intelligent man, and he's world renowned in quantum physics. He's got dizziness, so he's walking and he's touching the wall as he walks. We talk on Skype, and I start asking the questions. And at the end of the conversation, I said, I think you have a virus in your head. It could be in your brain, in your cerebellum, it could be in your ears, but there's a virus in there. So we sent the supplements over to him, and I gave him the antiviral diet. 6 weeks later, which was 2 days ago, I'm on Skype with him again, and the first thing he says is, I am 50% better. I thought I was a goner. You saved my life. I talked to all the doctors in my city, and nobody could figure it out. And I'm a physicist, and I have smart friends, and I have done all my research. And he goes, and you knew right away. How did you know right away? And my answer was, well, because I've seen other people with the same symptoms, and it's the same cause. And luckily, I do the muscle testing procedure, and I see people in my office. And just, being in practice since 1997, figuring these things out, working healthcare like a puzzle. And anyways, it's thrilling. He's just thrilled. And he said, when will I be 100% better? And I said, well, if you're 50% better in 6 weeks, maybe be 100% better in 6 more weeks. theoretical, could be 6 months, who knows, but just keep going. And that's another lesson, right? If you're getting better, keep going. Don't start changing things. Don't, because it's kind of human nature to try to always change something, even if it's working. I'm sure you you can apply that to other things beyond healthcare, maybe politics or something, or business, for example, or relationships. But if something's really working well, keep going. And if you change it, just tweak it a little bit. You can make something a little bit better, or you can if you see something good getting a little worse, just tweak it a little bit so it doesn't get worse anymore. So, anyways, it's thrilling. It's cool to help people like that. Now, I have another patient, and she's a endurance athlete, college aged, and I've actually known her for a long time, and have not seen her in a few years. So she came back recently, and I saw her list of symptoms, and I know that because she's so active athletically, I immediately ruled out a lot of things. I ruled out organ dysfunction, like it's not her heart, it's not her muscles, it's not her bones, it's not her nervous system. And then I ruled out fungus, because she wouldn't be able to run like that and have performance like that if she's loaded up with fungus. And it's not parasites, because she would have these other symptoms. And it's not a virus, because she would have these other symptoms. So I read her history. I knew immediately it was Lyme disease, organisms living inside the cells. And she had study problems, like being able to focus and process with abstract thoughts or just with words. And so she came in, I did the muscle testing procedure. I put her on 2 supplements. And within a few days, her brain starts working better. She told her mom that when she wakes up in the morning, now she's happy. She hadn't done that in a long time. You should be able to wake up in the morning and be happy. Not that I'm a morning person personally, but there are people who used to be happy in the morning and now they're not. And maybe it's because you have an organism inside your nervous system or affecting your body, your circulation in some way. So again, and I'm saying this because I've just been at this for so long, and I've been able to figure out things to rule out immediately based on the symptoms. It's just cool. Now, having all that knowledge and experience and ability, it's great, but there's always stories I've heard throughout my career that always keep my ego in check, and I'm going to share one of these stories with you right now. I used to know a woman, and she was from India, and she had medicine in her family. For example, her father and her grandfather did traditional Indian medicine called Ayurveda, which is like 6,000 years old. It's the oldest healthcare system in the world. And she told me the story. She had a brain tumor, and it was diagnosed at University of Michigan Hospital. And what she did to fix it was she hummed a certain tone from her vocal cords, and she erased the tumor out of her brain with that frequency. And it was verified at oncology at University of Michigan. And she told me this story, and she was in her 60s at the time. This is 20 years ago. And she asked me, would you like to learn everything I know? She wanted to pass on her knowledge to somebody. She didn't have anybody. And I actually declined. Because it wasn't my thing. I want to stick with nutrition, whatever. But hopefully she found somebody to pass that information along to. But how cool would that be? You know, you could match a cancer tumor with a frequency, and you can use a device, or you could use your vocal cords, and you could just make it erase or disappear over the course of weeks or months. These are the kind of stories that keep me intrigued, to keep me learning. Plus, the other thing that keeps me going is the demand. So patients come to me, I think I have an answer, but then I don't get that answer. I don't get the solution. And so it's like, okay, I'm missing something. And that's the free market. Supply and demand. I have to have that supply to match the demand. The last lesson I learned I want to share with you is about a guy that when he first came to me, I think it's just over 2 years, it was about 2 years ago, and he was very ill from head to toe, and he had a white coating on his tongue. And so we started killing fungus and doing other things, and he was eating liver, and he was even eating raw liver. He had some prostate issues, but he's getting better and better and better. It's been great. And he told me recently that 2 years ago he would scrape his tongue to get the white off, and he could scrape it for 45 minutes, and there was always something coming off. That's how filled up his body was of yeast. Now, when he scrapes his tongue, he can only scrape it for 2 minutes before there's no more white yeast coming out of his tongue. So just a picture that. Just imagine your body's so filled up. When you scrape the yeast off your tongue, more comes out, and then more and more and more. Okay, these are the lessons I wanted to share with you, and we can all learn this together. I learn a lot from my patients. Thankfully, in the nutrition field, I'm not beholden to the pharmaceutical companies. I can actually be creative with all the nutrients that Mother Nature supplies, and it can help people. And it can track the results over weeks and months to actually get somebody better instead of trying to cover their symptoms with poisonous medications. So make sure you jump into the free course that I have. It's on the front page of my website. Just go on the front page, scroll down a little bit. You'll see the image of a book and then a tablet reader with the insignia on it. You can just click on it. You don't even have to give me your email address. Just download the ebook right then and there. Then the video course is also free. And just start watching the videos. I spent many, many months putting this all together, and it's the accumulation of my career knowledge. It's not all of my knowledge, but it's like putting all the pieces together, and it defines what I've learned, and it defines all of medicine from 1847 all the way to 1961, and it's information that everybody needs to have. That old information that you've seen me talk about in previous videos, it's so super valuable, and I want to share with you this book that was just gifted to me by a patient. It's huge, and it's called The Library of Health. It's not the book, it's The Library of Health, 1927. And then it comes with this little booklet instructing us on how to use it. And I just got it yesterday. I haven't been through it, but I can tell you the first quote on the first page of this instruction book. The maintenance of health is the first duty of the Patriotic American. This is from the U.S. Public Health Service, Washington, D.C., 1927. So it is your patriotic duty to get healthy, and I hope that I can help you in that endeavor.